Good morning. I'm Lucy Beadnell from the ARC of Northern Virginia, and we are excited to be here today to talk about both the basics of Medicaid waiver and give a sense about how Medicaid waivers can interact with the education system since it is Education Month. As a visual description, I am a middle-aged white woman with long, dark blonde hair. I'm wearing a white and navy striped shirt and in a room with a mostly white background and bookshelves. I use she, her pronouns. During the webinar, if you're watching live, you can put questions in the Q&A question bubble anytime. And we look forward to having your questions. If you have questions after the webinar today, or you're watching this recording to later, you can always go to the arcofnova.org/answers and put a question in, which will come directly to me. And I'm so happy to help you. Without further ado, we'll go ahead and jump right into our Medicaid waiver basics today. The ARC of Northern Virginia, I just wanted to give you a little sense of who we were if you don't know already. We are a nonprofit that has been around. This is our 60th anniversary year. A lot of our work is focused on advocacy. So that's making sure people with disabilities and those who love them know about policies, laws, regulations, etc., that could impact them and have a strong voice in making sure that things go well. We do a lot of education, which would be things like this webinar. We do workshops and presentations all over the place, including custom presentations. So for example, if you needed one for your school, your Special Olympics team, your what have you, feel free to reach out and ask. We do a tremendous amount of information and referral, and that's just people reaching out to ask us questions on all manner of things. You can't ask us too many questions. We're happy to help. I hope that I know the answer to your question, but if not, we'll help you find somebody who does, or we'll give you the best answer that there is that we know about. We have our largest team on staff does case management for the DD waivers, one of the types of waivers that we'll be talking about today. So they help people navigate waiver services once they have a waiver in place. That same team, our services team, also works as public guardians for individuals who need a legal guardian but don't have anybody available to serve in that role. We have a special needs trust team who helps individuals with disabilities plan financially for the future, save money without jeopardizing benefits eligibility, manage and invest money, those kinds of things. And we'll talk about that a little bit today as it relates to special needs trusts. And we have our Tech for Independent Living team that works on apps like for smartphones and iPads and things like that, that helps people with disabilities use public transportation with greater ease, be more successful and independent in employment and daily living, and a host of other skills. Today, we're going to go through the purpose and description of Medicaid waivers. What exactly are they? Then we'll talk about eligibility and the services they offer. So once we have that good base and what a Medicaid waiver is, then we'll talk about how would we apply, because there are two different kinds of waivers and we want to know which would be the right one for us or both before we talk about applying, right? Then one of the sets of waivers has a waiting list. And so we'll talk about what that waiting list looks like and how to navigate it. So in the beginning, when you hear me say there is a waiting list, I promise you, we'll get to it and we'll get into some details about that later. And then at the end, I'll share my contact information and I'm happy to take questions for the time that we have set aside today. So jumping right into the purpose and description of waivers, they are a Medicaid program. We traditionally think of Medicaid as that health insurance for people with disabilities and people living or experiencing poverty. And that's true, but and that's the big piece of Medicaid. But there's a subset of Medicaid, a smaller piece called waiver. And that means instead of offering health services to everybody, we're offering extra long-term care services to a small group of people, in this case, people with different types of disabilities. Why do we talk about waivers so much? Well, in Virginia in particular, they are meant to be a one-stop shop for people with a big range of needs. By that, I mean, if you're young or school-aged or middle-aged or aging in place, a waiver is appropriate for you. If you have high needs or low needs, a waiver is appropriate. Hands-on care needs, medical needs, behavior needs, waiver. So big range of people, big range of needs. And generally speaking, once people get a waiver, they keep it for the rest of their life, unless for some reason they decide they don't want it anymore. They move out of state because waivers are state-based, or they somehow become ineligible, which is pretty rare. They are the only public funding stream, and by that I mean free or very low cost for people with disabilities. So when we talk about needing help over a long period of time for employment, living more independently, managing supports and medical needs, then waivers really are the way that Virginia funds those kinds of services. So incredibly important for a big range of people across the whole lifespan. And really there's no substitute or alternative for them in Virginia. So we're going to look today at two broad types of waivers. The first are at the top of the screen, and those are the three developmental disability waivers. Their separate names are the Community Living Waiver, the Family and Individual Supports Waiver, and the Building Independence Waiver. Those are often called by their initials. Community Living Waiver is called CL, Family and Individual Supports is often called FIS or FIS, and Building Independence, usually called BI waiver. Those three waivers we're going to be talking about in a group today. You'll see that they share an application process. They share eligibility criteria. They share a waiting list, and they overlap on a tremendous amount of services. So for a lot of functional reasons, they're identical. Right up until the point at which we're using the waiver and we're selecting a particular service, there really is no difference between them. So for our purpose today, understanding the basics of waivers, we'll talk about them as one big group. As there are differences, I'll point those out, but really be thinking about them as a chunk, as our three developmental disability waivers, and they work very similarly. We'll be comparing them today and also talking about our Commonwealth Coordinated Care, or CCC Plus waiver. If you knew the waiver system prior to 2016, it had some different names. And so as we go through things today, I'll say, this is what, for example, eligibility is like for the DD waivers. Then I'll say, this is what eligibility is like for the CCC Plus waiver. And on everything we talk about, we'll go back and forth so that we can kind of compare them. But I want to start off with kind of a high level comparison so you can, if you will, open some files in your mind about, why would we look at these two waivers, and are one or both appropriate for me? I do this because waivers are complex. I don't think anybody should expect to leave this presentation, especially if it's your first time hearing about waivers, understanding and processing absolutely everything that I say. I think if you leave here today with a sense of, is a waiver a good idea for us to explore? Should I explore one, the other, or both? And if I'm going to do that, who do I call? That's good news. Okay, that's what we really want to walk away with. So let's kind of do some high level looking at that to start funneling that information through our brain. For the DD waivers, you need a developmental disability diagnosis. So if you are a person with a disability or a parent, you probably know what that looks like, right? The autism, Down syndrome, cerebral palsy, a big range. I mean, there are thousands of diagnoses that fall under that DD umbrella. And the DD waivers have a really big menu of services for little ones. You know, maybe you need drop-in supports at home or on the weekend, all the way up through aging in place. Maybe you need significant 24/7 care. Maybe you need a nurse. Maybe you need lots and lots of layers of support. That can all be offered. And it comes with a case manager. And since this is talking about waivers kind of in collaboration with education system, this is the first thing I'll bring up, that the waiver services themselves take place outside of the school setting. Your case manager is one of the people who can go back and forth between them. So years ago, I was a case manager, usually called support coordinator for the DD waivers, and I could attend transitioning students' IEP meetings, for example, or talk with their school social worker, or share information about how waiver and school services were going to intersect, right? Because school services are taking place at home, at school, waiver services are taking place at home or in the community, but there's transition between those, right? Both the transition when the student's aging out of school, and we want to make sure that as school services fade away, waiver services are swooping in to pick things up, but there are also services in the afternoons after school and on the weekends. And are we making sure that that student has a good life? So that's one example about how your waiver services, in this case, case management, sort of overlap with educational services. That is not to say all case managers can attend every single IEP or that they're education experts, but it is to say that school services and waiver services sort of touch on the fringes, and you want to make sure they're talking with each other, if you will. The DD waiver has a long waiting list. And like I said, we'll talk about that at the end, but kind of keep in mind, Wow, it seems like this is a great waiver. Big menu of services across the whole lifespan, but there's a wait. And that's why we talk about the CCC Plus waiver. It requires a disability diagnosis, which could be a developmental disability and could be a big range of other things. This was designed to be a nursing home diversion waiver. So a lot of folks who use it have diagnoses we would more associate with aging or later years, things like Alzheimer's or dementia, for example. For the CCC Plus waiver, not only do you need a disability diagnosis, you also need a medical need. And we'll parse through what that is in a second. But if you're hearing this and you're thinking, oh, my child has a lot of medical complications, I should be thinking about this too. Or you're hearing this and you think, nope, other than picking something, autism, my child has really no medical needs, we don't have any specialized support needs, then you're probably only going to be listening to the DD waiver side today, and you can give your brain a little break when we talk about the CCC Plus waiver. The CCC Plus waiver, again, it's meant to be a nursing home diversion waiver. So it's not going to have the equivalent of employment services and residential and community services, right? Because that's not what nursing homes offer. They offer personal care and nursing. So it's going to be a relatively short menu of services. There's a cap on the number of just regular one-to-one care hours the person can get each week. There is no case manager to help you best navigate your waiver and services in and outside the waiver, but there's no waiting list. So I say that to say at any given time in the last decade, at least I'll say, about a quarter to a third of the people waiting for the DD waiver were using the CCC Plus waiver, right? It was their lifeline. It was something they could get in the meantime because they happened to be eligible for both. So with this kind of very broad understanding in our head, let's dive into some of the details about waiver eligibility. And I'll talk about that in three pieces. Your diagnosis. How do I know if my diagnosis makes me eligible for one, the other, or both? Your functional needs. How do I know if the hands-on care and support I need each day makes me eligible for one waiver, the other, or both? And financial criteria. How do I know that Medicaid won't say we are ineligible for the waiver because of the money we have in the bank? All right, so as promised, we'll go back and forth between DD and CCC Plus waiver. Please do not feel the need to panic as you look at this slide. I don't care for this slide, but whenever I say the widely accepted definition of developmental disability, someone very wisely raises their hand and says, what exactly does that mean? So here it is spelled out in black and white. Most likely, you know, if you or your loved one has a developmental disability. If not, that's a great question for the Q&A, or you are always welcome to send us at the ARC of Northern Virginia a copy of someone's evaluations, and I'm happy to take a look at them. You can ask the person who wrote the evaluation. And by this, I don't mean that that has to be the person's only diagnosis or primary diagnosis or diagnosis on their IEP or educational category on their IEP. None of that. I just mean that the person does have a developmental disability. A lot of times people say, oh, actually the person who diagnosed us is the school psychologist. They did an assessment and an IQ score. That piece matters when applying for a waiver. There's no minimum or maximum or right or wrong, but they do want to see the IQ score. So I'm going to use that evaluation that the school did for educational purposes to apply for the waiver. So that's another example of how kind of waivers and the education system, intersect. So DD waivers, we need a DD diagnosis. On the other hand, for the CCC Plus waiver, we need some kind of disability diagnosis. You could use that same evaluation from the school, from a private psychologist, from anyone you've had give a diagnosis over the years, plus medical needs. And there is no list that clearly says, these are the types of medical needs that mean you have an adequate medical diagnosis, because it's not quite that simple. It's not, I'll give some examples, right? It's easier to understand things with examples. It's not, does the person have a seizure disorder? They're automatically eligible. It's, if the person has a seizure disorder, do they have a seizure protocol in place? Do they regularly see a neurologist? They have a vagus nerve stimulator? Do we have to teach everyone around them to monitor for absent seizures? Do we really regularly have to manage seizure medications? Those kinds of things. Really meaning, do we have professionals in their life, neurologist, nurse, physician, therapist, etc., working on these issues? Or did the people in their life have to be trained by them to take care of this person? So another example of that is G-tube feeding. It's not wildly complex once you learn to do it, right? So for most parents, they're able to do that if their child needs it. But if a nurse had to teach you to do something like that, you likely have a qualifying medical need here for the CCC plus waiver, right? So it's not what medical diagnosis you have. It's based upon that medical diagnosis. Do you have a professional or someone trained by a professional, like your parents, giving you help or not? So if someone had a seizure disorder, but they hadn't had a seizure in 15 years and they don't see a neurologist and there is no seizure protocol and there is no seizure medication, then probably they're not eligible here, right? So I can't tell you, no one can. Off the top of my head, I can tell you right away if you list out the support needs the person has, whether or not they're eligible. But this green link in the middle of the screen, and remember, you'll get a copy of these slides, or if you're watching this later, you can always ask us at the archivnova.org/answers for a copy of the slides or just this link. I think it's a great self-assessment. It'll walk through what's the person's hands-on care needs for bathing, dressing, using the restroom. Those are big ones for the CCC plus waiver. And what are their medical needs? And based upon your answers, we think you're likely eligible or not. It's not a guarantee that you'll be eligible, but it's a good tool. If you're thinking, is it worth my time to apply for this? I'd say take 5 minutes and do that self-assessment online, and you'll get a good sense of, do we have enough of a medical diagnosis and medical support need to be eligible? Okay. So hopefully now we have a sense of, does my diagnosis mean I'm likely eligible for one or both of these waivers? Now let's look at functional eligibility. So waivers want to know not just do you have a disability, but do you have significant support needs? And we already started talking about that a little bit with our CCC plus waiver. So for the DD waiver, that do you have enough support needs to get waiver services comes through an assessment called the VIDES. That's an acronym for the Virginia Individual Developmental Disabilities Eligibility Survey, which is a very accurate and also very wordy title. There's a version of the VIDES for brand newborn babes until the day before they turn 3, for 3-year-olds till the day before they turn 18, and 18 plus. And that's because we are comparing children with disabilities to typically developing peers. Are we seeing that this child has greater needs than typically developing peers in the areas listed here? Health, communication, task learning, personal and self-care, mobility, behavior supports, community living skills, and financial self-sufficiency. That's 8 life areas. To be eligible for the waiver on the VIDES, they'd be looking to show that at least 3 of those 8 life areas, you do have significant support needs. One of the reasons that I like the VIDES is because it's a public document. And on page 2 or 3, it will say, we're going to ask about these 8 categories. Okay, so you go through and if someone's going to give you the test ahead of time, I'm a big fan of look at the test ahead of time. So you go through and you say, okay, I'll answer all these questions just like as if I was being formally interviewed. And then I'll go back to that front page and I'll say, okay, it says in health status, did I say these things happen often or not often? Did I meet eligibility in that category? And you can go right on down the list of the 8 categories to say, did I meet in 3 out of these 8 categories? And if not, was I really close? I think looking at the VIDES is really interesting because you can see things like the difference between saying something happens every week to 10 days can be wildly different as a score than saying something happens every 2 weeks to a month. It's a good thing to look at it ahead of time and get a sense of really how often does this happen? If we're looking at someone on a rough day, what are the supports they need to do these things successfully? That does not mean on their best day, are they happy to take all of these supports and services and they need no help, right? It's looking at what does this person really need to be successful on days when we're struggling? And that's kind of the framework that we want in answering the VIDES. If you have any questions as you go through the VIDES, feel free to let me know. If you look at the VIDES and you think, goodness, this asks some personal questions about bathing and dressing and restroom things, and I can tell you right now, my loved one with a disability is going to hate having this conversation when we talk about stressing their needs for going to the bathroom in front of a stranger. Well, that is fair. And I don't know very many people who would like that conversation. So since you have the test ahead of time, it's a great opportunity to say, okay, kiddo, this is going to be kind of a yucky meeting because we have to talk about these things. Do you want to know what mom's going to say? Do you want to say those things? Do we want to plan to get ice cream or go to the playground or go to a movie or whatever makes you happy afterward for getting through this rough thing? Or do we want to say to the interviewer, I've seen the VIDEs already. I know you need to meet with the person with a disability, because they do when we do this. But when we get to the section on behavior or on personal care, my loved one would like to put on a headphone set and listen to their iPad. We've talked about what we're going to talk about, and they just don't really love when we stress the needs about those kinds of things, and they're going to take a break. Okay, that's cool. So we know what the VIDEs is. It's linked on the ARC of Northern Virginia's website. Across the top of our website, there's a link that says Resource Library. And if you click on the waivers section of that library, all the VIDEs versions are there. You can copy them and print them out, etc. For the CCC Plus waiver, they use a different tool called the Uniform Assessment Instrument. It's usually abbreviated UAI, and there's a link to it here. Unlike the VIDEs, you can't answer all the questions and then go back to the front to see if you're eligible or not. That assessment is interpreted by a nurse. It's not a black and white, these questions mean you are or aren't, but you'll see big focus on bathing, dressing, restroom, medical needs. You will get a sense of, am I answering these questions repeatedly and saying yes, or we really know on most of these questions. Again, if someone's going to give you the test ahead of time, by all means, look at it. This link will take you there. And again, if you have any questions about that, feel free to let me know. So by now we should know, okay, does my diagnosis make me eligible for one or both waivers? Do my functional needs likely make me eligible for one or both? And if I'm not sure, I'm going to go in and check. Okay, financial eligibility is really the same for these two waivers. The person with a disability only, if they are 0 months old or 17 or 30 or 80, it doesn't matter. Child, adult, living at home, living away from home, independent, not independent. I really want to drill down. No matter where they are living or their age, only the income and assets of the person with a disability count. For waiver, there are special rules different than standard Medicaid health insurance. Regular Medicaid health insurance says we're going to look at, unless the person's an adult, the whole family's income and assets. Waiver is a special permission to ignore those whole family income and assets and only look at the person with a disability. So sometimes some folks come to us and say, I was denied for Medicaid. Does that mean I can't get a Medicaid waiver? No, the rules are different. Medicaid waiver rules are more flexible and permissive by design. That's part of the waiver, our changing of the rules to get people what they need. Medicaid waiver says the person with the disabilities maximum income can be no more than 300% or 3 times the current amount of supplemental security income. If that sounds like a bunch of gobbledygook, that's fine. What it really means is the base Social Security benefits to people with disabilities times 3 is as much as the person with a disability can be earning a month. And in terms of actual dollars, in 2022, that means the person with a disability can't have income more than $2,523 per month. And Social Security benefits adjust with inflation, so that number will adjust with inflation too. So again, only person with a disability, if their income is 0, that's just fine. There's only a maximum. Once the person with a disability has income over, and this number also adjusts with inflation, about $1,300 a month, they start having a copay for waiver services. But if their income is under $1,300 a month, all the waiver services in the world are completely free to them. Adults using Medicaid waiver cannot have more than $2,000 in assets in their name. That's the same limit as there is for Social Security. So it's a real good one to remember. That number hasn't been adjusted since 1989 for perspective about why it's so low. But that means if we add together any bank accounts, any stocks, savings bonds, etc., with that person's name on them that they can access, those all together can't total more than $2,000. For children, they aren't legal owners of property, right? So their assets don't count, but you really want to keep an eye on as that person gets close to 18 and we made sure that they're still going to be eligible. And I want to drill down again, parent income and assets never count in terms of an individual with a disabilities waiver eligibility. So if you think $2,000 is not very much money for a person to ever be able to save in their whole life? Well, I would say that is most certainly true. And as I said in the beginning, the ARC of Northern Virginia operates its special needs trust. And I'm looping back to that now. And we set that program up because we wanted to make sure people could continue to be eligible for programs like Medicaid and Medicaid Waiver and Social Security and housing vouchers and energy assistance and all those kinds of things that are really important for folks with disabilities to maximize independence. And income and assets held in a special needs, or assets, excuse me, held in a special needs trust do not count against you in terms of waiver. There are special rules around how a special needs trust money is counted. And for example, someone with a disability could save money, inherit property, buy property, a life insurance policy, all those kinds of things can be held inside a special needs trust with no maximum, as many millions of dollars as they wanted to own in there, without being ineligible for waiver. But if that same amount of money was held by the person with the disability in their regular old bank down the street, then they'd be ineligible for all these programs. So a great reason to think about special needs trust, even if you don't think you have anything to put in it now, do you want it there to be able to catch inheritance from family members, things you plan to leave for the person with a disability, money they want to save, etc. At the Arc of Nova Trust.org, right across the top, you can sign up for free events and workshops or consultations with us if you want to talk through that. Okay, so now we have a sense of, all right, there are these DD waivers and the CCC plus waiver. I may be eligible for one or both. What does that mean if I'm eligible? And let's go through these services. And like I mentioned, services won't take place inside of school, but can take place outside of school, before, during, after school, after graduation, etc. Services will be based upon the person's need. So for example, if someone has no nursing needs, they're not going to be offered nursing services. But as you sit down with your waiver team, you should be talking about, how do I match the need that this person has now with a service up that meets that need? And of course, that can change over time. Okay, this is another set of slides. I believe there are 4. Don't feel like you need to memorize them. This is sort of to help your brain get a picture in it of, I can see across the top, the community living, family and individual supports, and building independence, those 3 DD waivers. When we're looking at, on this slide, residential services, they all offer some kind of residential services. For comparison, the CCC plus waiver all the way over there on the right offers no residential services, right? So this is kind of us getting a sense in our mind of, okay, do waivers offer options for the kinds of things that I need? And as I mentioned, the DD waivers can offer up to 24/7 awake staff if that's what the person needs. There can be 24/7 staff sometimes sleeping if, for example, there was a live-in caregiver who, of course, would be allowed to sleep at night, but would be on call like a parent, right? That's what we do for our kiddos. There are options where you can have drop-in support. People with disabilities can live in an apartment or condo by themselves with staff brought in, or with a roommate who is staff, or with 1 to 2 friends and staff brought in, or staff living in, or in group living situations, right? So Virginia has done a lot to try and expand the array of residential services offered under the waiver in the last few years. And we're really starting to see providers start to meet those needs. And so I would say a good thing to think about here is, imagine the scenario in which your loved one does best, right? I mean, the traditional model was a group home where you're in a large setting. You don't choose your roommates, you don't choose your staff, but they're always there. The roommates are always there and the staff's always there. So if if you come from like a big loud family and your loved one loves that kind of chaos, then maybe that's a great fit for them. If they are someone who needs quiet, who needs staff who really are a good personality fit for them, if they are someone who needs a smaller space, maybe smaller residential setting would be a good fit for them. So you can choose the service that the person needs and make sure that your waiver funds that. If, for example, you say, let's look at our chart here. We have the family and individual supports waiver. And what we really want is this option down here toward the bottom called sponsored residential, where someone has a person with a disability move into their home, and they are the caregiver. And maybe the person with the disability goes out to work and volunteer and all kinds of other things, but they're living there with them. And that's really what we imagine we need. Then you would say, okay, that's not offered under my waiver. We need to talk to my case manager about how can we get that service in place Can I show that all the services available under the waiver aren't a good fit? And can we apply to change waivers? And you can certainly do that. Now we'll look at day and employment services. And here you can see the DD waivers all offer the big range of day and employment services. But again, for comparison, the CCC Plus waiver doesn't offer any day and employment services. So as we're thinking about intersections with education, for kiddos in school, not offering day and employment services is not really a big deal, right? Because they're at school during the day. But as we look toward graduation, this is a good time to be saying, I need to be in touch with the folks about our waiting list spot for the DD waivers, because as we graduate, I need to make sure day and employment services are going to be available. We're going to need them. And the waiver we have now doesn't offer them. The waivers day and employment system has been redesigned over the last few years so that someone can mix and match these services. So let's walk through that as some examples. I'll make up a person. I'll name her Angela. Angela has a DD waiver, and she has some day and employment skills and a big range of interests, but we're not yet ready to work full time. So let's look at, as some examples of the waiver services, what things could look like for her. So one service is called community engagement, going out in a small group to kind of build some of her skills. So maybe with Angela's day and employment provider on Monday, she and a group of other folks go out and they practice grocery shopping. They have a list that they've used of the things that they need to make healthy meals that they're going to have to bring for work lunches. They practice going out to get those groceries, navigating public transportation to get there. Another waiver service is supported employment, and that can take place either individually or in a small group. So let's say on Tuesdays, Angela works at a local bakery, and the waiver has a job coach who's there with her, and she really can only work one day a week at this point because that's where her stamina and her skills lie, but the bakery loves her and the staff that come to help her, and Angela loves her job there and she gets paid a wage. Then let's say on Wednesday, Angela goes to a day support center, usually center-based, large building, folks with disabilities and paid staff. And there she works on learning some life skills, and she does some relaxing things like therapies or arts and crafts. And then let's say on Thursday, Angela works one-on-one with a community coach who says, okay, Angela, the biggest barrier to you being able to work at the bakery longer is we are not yet ready to stand on our feet for 8 hours a day. It makes you angry and tired. And when you're angry and tired, maybe you hit people, right? So maybe they work one-on-one with Angela on how do we build up that stamina? How do we find other ways to manage that frustration? So you can kind of get a sense of, most people don't mix and match quite this way. Most people choose one or two services, but you could. And then there's workplace assistance and benefits planning to help make sure that our waivers, that income cap we talk about, don't come into conflict with the income you're earning with work, right? So there are people to try and make sure all these systems work together. Okay, and now we'll talk about services that can take place in the home, by which I mean if the person with the disability is living with family or if they're living in their own home. And here we see our CCC Plus waiver finally offers some support. So all of the waivers in some form or fashion offer some kind of one-to-one caregiver that happens on a regular schedule. So for example, you would say, I don't know, 15 hours a week after school or after work and a few hours on the weekend. Maybe that's what it looks like. The two DD waivers, community living and family and individual supports, as well as the CCC Plus waiver, offer respite, 480 hours a year of care on top of that regularly scheduled care, recognizing that kids have breaks for summer, for spring holidays and winter holidays, and we need time to bring extra staff in. We don't need that extra staff every single week, but on those occasions that we do need them, we'll pull from those respite hours. All of the waivers offer up to $5,000 a year for environmental modifications to change the home or car of the person with a disability to make it better adapted for them. All of the waivers offer what's called the personal emergency response system, like a push button remote monitoring system if the person's ever going to be alone for any period of time on a regular basis. So that instead of them having to know something's wrong, I should call 911, I should tell them this, they just push a button and it says, Angela's pushing the button. This is where she lives. This is her disability and what she needs. Please go ahead and send out some support folks. The 3DD waivers offer electronic home-based services. This is something we've seen folks use in big numbers here in recent years, in part prompted by COVID, but these can be things like if the person with a disability is looking at living more independently, can the doors on the front door automatically lock themselves, or can the stove automatically shut itself off? If the person with the disability is going to be alone for some period of time, can they always have the option to press a button and remotely speak live with staff somewhere who can help them problem solve and help them if they're feeling lonely or anxious? Can we put sensors in the apartment to make sure the person with a disability isn't up and roaming all night long? Or if they are, then now we know it. We can add in some more support services, those kinds of things, which are really cool. All of the waivers offer up to $5,000 a year for assistive technology. That's like portable technology. And I'll say the thing I see most common to give you an idea is things like iPhones and iPads or similar with communication software, but it can be a big range of things that are portable to help the person be more independent. The DD waivers offer in-person and site-based crisis stabilization. The DD waivers offer a community guide to help someone really deeply navigate services in their community and break down barriers. And the DD waivers can offer reimbursement for transportation. And to be clear, that's like whatever the federal reimbursement rate is for mileage. I think it's 50 some cents a mile right now in 2022. So that doesn't mean it will pay for you to take Metro Access somewhere, but it does mean if you have a parent, sibling, neighbor, caregiver driving you, the waiver could reimburse them by mileage for that trip with the DD waivers. So that was kind of a whirlwind view of what the waiver offers, but bear in mind our 3 DD waivers have a significant waiting list. So when you are applying for the waiver, you may not necessarily know what kind of services that person is going to need by the time they get a waiver. So don't feel like you need to memorize all these services or you need a deep understanding of them. The job of a support coordinator when you get a waiver is to sit down with you and have a real in-depth discussion of, let me get to know this person with a disability and let's start matching their needs and their wishes up with waiver services. So today is just kind of meant to give you a flavor of, okay, I can get a sense that we could get services in a range of settings. With this CCC Plus waiver, hopefully you're walking away with the sense of, okay, I could get a one-to-one caregiver, some respite, maybe a little electronic support here and there. And last slide, some nursing care that most of the DD waivers and the CCC Plus waiver offer. The 2 of the DD waivers offer therapeutic consultations, not ongoing therapy, just a consultation. But with the waiver, you also get Medicaid health insurance because Medicaid is going to pay for the person's waiver services. That's a great bonus benefit, if you will, because Medicaid health insurance will pay for ongoing therapies like OT, PT, speech, behavior support therapy, a big range of things. Medicaid waiver, Medicaid, meaning the health insurance piece of it, can pay for those therapies inside, and almost all school divisions in the Northern Virginia area at least have parents sign a document saying, oh, you have Medicaid because your child has a waiver? Can we as a school bill Medicaid for the services our OT, PT, SLP offers to your child? That's a great win to the school because instead of that therapeutic funding for that staff coming out of their budget, they can bill Medicaid for it. It's one of the very few times you can bill Medicaid for a service taking place inside a school. So that's an option. You can choose to do that or not. It doesn't change your child's eligibility for getting those therapies in school. It's just a help to the school's budget because they send the bill to Medicaid instead of paying it directly. Okay. So there's kind of a rough view of services. Now let's go on for applications. So hopefully by now we have a sense of, should I apply for one or both waivers? What does that get me? Okay, this sounds pretty good. How do I apply? And for all 3 of the DD waivers, like I mentioned, they share an application process. You're going to call your local community services board. It's a county government agency or city. And in Northern Virginia, it's all by locality. So if you live in Loudoun, it's the Loudoun Community Services Board. If you live in Arlington, it's the Arlington Community Services Board, so on and so forth. You'll call them up. You'll say, I think I may be eligible for DD waiver services. We'd like to apply. They will send you an application. You will fill it out and return it with that evaluation showing the person has a developmental disability that we talked about. Then you'll meet with them and you'll do the VIDEs that we talked about. So we've shown the diagnosis on our evaluation, then we do the VIDEs to show our functional needs, and then you'll get a letter saying, okay, you're on the waiting list. More on that in just a second. For the CCC plus waivers, you're calling your local Department of Social or Family Services. Right there on the phone, they'll do a screening for you. Again, they're asking a lot about bathing, dressing, restroom, medical needs. If those questions go well, they'll send out a nurse to talk to you in person who asks very similar questions in person. And if that goes well, then they'll say, looks like you're eligible for the waiver. There is no waiting list. You can start receiving services after we get through kind of the process of getting the Medicaid in place, lining up service providers, those kinds of things. It usually takes at least a handful of months. So not immediate start to services, but relatively fast. Okay. So DD waiver waiting list, the thing we've all been waiting to talk about, right? All of the people applying for the DD waiver on a shared waiting list. You're not saying, I only want the building independence waiver or the community living waiver, et cetera. You're saying, here are my needs and I'm on the waiting list. And that waiting list is based upon urgency of need, not just of the person with a disability, but looking at their whole situation. So by that, I mean, if the person with a disability has really complex needs, and we've got a single mom as caregiver who works 2 jobs to make ends meet, and she's barely able to hire caregivers, and the child's aging out of school age childcare, and we don't have a safe place for this kid to go, that's an example of an urgent need. Or maybe the person with a disability has relatively mild needs, but both parents have significant mental health care needs going on and are not able to support the person very successfully. That's another example of an urgent need. The person's about to graduate from high school and has no waiver to fund day or employment services or places to go. That's an urgent need. All kinds of things. The person's regularly having a behavior crisis. So once you're on that waiting list, there's a volunteer slot assignment committee that says, okay, our state government has agreed to fund new waivers. They funded this many of this kind and this many of that kind and this many of those kinds. And we're going to match make. We're going to say, based upon the needs of people on this waiting list, we think this person is a good fit for this waiver. Let's offer that. Okay. So it's a tricky process. And you also certainly want to make sure that once you're on the waiting list, your local community services board where you applied and where they're managing that waiting list knows your needs. Because maybe you applied when you were 8 years old or your child was 8 years old, their needs are probably going to look very different by the time they're a teenager. So you can always call them and advocate, hey, we really need a waiver. Hormones hit and so did the behaviors and life is complicated and this is what we need. Or now we're aging out of school, we need a waiver that's going to offer day and employment services and all these other kinds of things, right? You want them to know that. So when that matchmaking process is going on, they're offering a waiver that has the right kind of support services. When you were on the waiting list, you were in one of 3 priority tiers called 1, 2, or 3. The state put out guidelines saying priority 1 means you need services within a year. That is not a guarantee of when you will get services by any stretch of the imagination. So I don't care for those guidelines. I would essentially say priority 1 means you're the people who are going to get a waiver first. Priority 2 means you are unlikely to get a waiver until you move into priority 1. And priority 3 usually means you are young, healthy, and stable, maybe getting a lot of what you need through the school or parents or private insurance. Parents are able to take care of you or other caregivers are able to take care of you. You're doing well, but you've applied for the waiver and we know you'll need it one day. It's the Lucy Beadnell take on this priority tier list. Here is my contact information. The arcofnova.org/answers is the best way to get a question to me. So I'm going to stop screen sharing and answer questions, but I can pull the slides back up if you have questions related to some specific things that I said here. Okay. Do I have statistics around how many students still in school are receiving DD waiver versus being on the waiting list? Is that rare? That's a great question. I don't have statistics off the top of my head. DBHDS, which is the state agency that runs waivers, that's an acronym for the Department of Behavioral Health and Developmental Services, doesn't routinely publish waiver waiting list data by age. So that's why I don't have it. Not to say they can't do it or can't look it up. I will say, because the waiting list in Virginia right now is about 14,000 people long, in my experience, it's relatively rare for a school-age child to get waiver services. Usually school-age children tend to not be at the top of that urgent criteria. Usually that's because we've got parents or other caregivers who are best able to take care of them. We've got the school providing additional supports. We're working our way along okay. Obviously, you can imagine plenty of exceptions to this. I'm just speaking in gross generalities. So it is way more common for a student to be offered a waiver in their last year of school as they're aging out. I certainly do see children, even young children sometimes, who have DD waivers, and that's usually because there was either an episodic or a long-term crisis in their family that put them at the top of that waiting list. But the overwhelming majority of waiver users, and I'm trying to think, the last time I saw data on this, would be 2015, so grain of salt here, if you will. But at that point, more than 80% of waiver users were more than 22 years old. So overwhelming majority, and I would venture to say the statistics are even more skewed that way now. Oh, okay, great question here. Fairfax County assigned us a case manager, and she's great. That's super. But is this different from what you're saying that the ARC does as a case manager? Oh, what a good question. No, it's the same service. Now you're delving into the bizarreness of the Virginia waiver system. So the way Virginia regulations are written in Virginia. Remember I told you that when you apply for a waiver, you need an IQ score to submit with it, and it doesn't matter what the IQ score is. There's no minimum or maximum. That's true. So that makes you eligible for waiver services, that diagnosis. If you get a waiver, then you automatically get case management through the Community Services Board where you're living. Remember, that's that county agency, that CSB. So let's take an example. You live in Fairfax, you applied with the Fairfax Community Services Board through a waiver, you got your waiver through the Fairfax Community Services Board, so Fairfax Community Services Board will provide you with a case manager. There's this interesting twist in Virginia regulations, for reasons not interesting enough to take up time today, that says if the person with a disability's IQ is over 70, no ceiling, they could opt to have case management not with the Fairfax CSB, but with the ARC of Northern Virginia or another organization that does private case management. We're the only one in Northern Virginia that does this, so I'm using us as an example. So we're it. No matter the IQ of the person with the disability, to continue to offer case management choice, you can say the case manager we got in our CSB, again, we're using Fairfax as an example, Jane isn't a good fit for us. Can you assign us someone new? Oh, you gave us Tom. Tom is a good fit for us. Or you can say, I really don't feel like we're getting someone great from Fairfax Community Services Board despite trying a few times. We would like to ask Loudon if they'll be our Community Services Board case manager, because we're right on the western border of Fairfax and they're real close to us. You are allowed to ask that, and a neighboring CSB is allowed to take it up. In my experience, they're so swamped and so short-staffed, it's hard to get them to do that. So there's a classic Lucy, long, complicated answer, right? But so the ARC does the exact same waiver case management that the Community Services Board does, but because of this very strange regulation that, as you can imagine, we're fighting to change, we're only allowed to do that for people whose IQ is over 70. So if you're interested in that, you can reach out to, again, the arcofnova.org/answers, and I can answer this or remind you of this. But if you wanted to do that, you would just tell your existing Community Services Board case manager, hey, can you put us on a waiting list? I know you're so tired of me saying waiting list for case management at the ARC. And when we have a spot available, we'll reach out. Is there an annual cap on CCC plus waiver services? What a great question. For all waivers at this point, there is no cap on the services you can get so long as it's a service the waiver offers and you're eligible for it, with the exception of a couple things. There are some services that have caps. So for example, with the CCC plus waiver, that one-to-one caregiver just coming into the home on a regular basis, CCC plus waiver says you can't have that one-to-one caregiver more than 56 hours a week. You can have nursing on top of that. You can have some electronic supports on top of that, but that one-to-one caregiver service is limited to 56 hours a week. With the DD waivers, there are some services like a service called independent living, designed for folks over 18 living away from home. That's drop-in supports limited to 21 hours a week. So in some senses, there are limits on waiver services, but by and large, it's a good matchmaking process between what are the needs of the person and how do we fill that with waiver. Can you have a waiver and still keep Blue Cross Blue Shield insurance? I love that you asked this question. Yes, having Medicaid, because you have a waiver, doesn't change the status of any of your other insurances, period. Medicaid is always the payer of last resort. And what that means is you have to bill them as the last insurance. That's a Medicaid rule federally. So if you had Blue Cross Blue Shield, You can continue to use that to see all your doctors. If your doctor and your pharmacy and your hospital, et cetera, also took Medicaid, they could bill Blue Cross Blue Shield. Then they could bill Medicaid, which usually means you have a $0 copay, which is the case for most Medicaid users and most Medicaid medical services, which is great. So oftentimes people have more than one insurance. I've seen people with as many as 4. I'm trying to remember the situation. It was like someone had Blue Cross Blue Shield for life because of one parent being a federal employee, TRICARE for life because one parent was a military retiree, Medicare and Medicaid, and then they got billed in that order. So yes, and it doesn't affect your other insurances. This may have been answered, but how long is the waiting list? And you know what? I didn't answer it because there's not an answer. It's urgent needs based, which makes it tricky in and of itself, right? So if you got on when your child was 2 and healthy and doing well, you're going to wait a lot longer than someone who gets on that waiting list because they're an adult sibling of a 50-year-old with a disability. Both parents have passed away suddenly, and all of a sudden that sibling in another state is saying, parents never applied for a waiver. What are we going to do? And they're going to be at the top of the waiting list, right? So even an average or a median wait time, honestly, I think is completely useless. The best answer I can usually give people is more than a year, usually more than 2 years. I've seen people wait as long as 15+ years. Again, if they got on the waiting list when they were young, healthy, and stable, they had other services in their life, all those kinds of things. So it's real difficult to say. The ARC of Northern Virginia does a lot of advocacy to fund the waiting list and make sure that our state government is buying down on that waiting list, and that waiting list gets shorter over time. So we would certainly invite you to join us in that. For environmental modifications, and remember, this is the up to $5,000 a year waiver service to change someone's home or car. Would something be like raising a railing height be considered? Off the top of my head, if I'm interpreting this question correctly, yes, most likely. Environmental modifications say, is this used to correct or ameliorate a disabling condition? I think that language is terrible. I'm trying to quote the regs as best as I can. Or does it essentially keep the person like safer? Does it make them more independent? Those kinds of things. So if that was the case, then what I usually suggest to families is talk to environmental modifications providers. Their whole job is making sure these things get approved, because otherwise they don't get paid. And ask them, have you all seen this get approved before? What kind of therapist or professional wrote the recommendation? Or was it the case manager? And can you make some recommendations and suggestions? And they're usually the best experts on getting things like that in place. Okay, so there's a question here that I'm going to read through real quick. Give me a second. Okay, so this is a great question. If someone with a developmental disability is non-speaking and communicates via a letterboard or other AAC options, they would need often a communication partner to help them, right? So the communication partner is reading off that letterboard or that AAC device, interpreting what the person is saying. Right, and to be trained in how to do that. And all the person working with the person with a disability need to know how to do that. Right. So please, good golly, type in if I'm misinterpreting this question correctly. But the waiver could pay for example, the person with a disability and their loved ones and this newly hired staff sit down together for hours and hours, and they learn how to use this AAC device, because you can't support this person unless you can communicate with them in the way they communicate. The waiver could pay for all of that time. What the waiver would not pay for is, for example, the person with a disability needs a communication partner and a one-to-one aide, and they're not the same person. The waiver would consider that double billing and would it pay for 2 people at once. Can I differentiate between attendant care services and respite care services? It's the same service. I'm laughing because it's such a silly distinction in Virginia Medicaid. So attendant care just means one-to-one person helping with things like bathing, dressing, restroom, life skills, taking care of the house, eating, etc. on a regularly scheduled basis. So you would write a schedule that says, ideally, this person would come Monday through Friday, 3 to 9 p.m. and on Saturday on these hours. You would put that in for attendant care. Respite is 480 hours a year of a little separate pool of the same service to use if there's a week when your regularly scheduled care isn't enough. The parents are going to be out of town. The person with the disability is home from school on break. You can use the same exact attendant that you use for attendant care For respite care, the reimbursement rates are the same. It's just two different ways of calculating the hours, recognizing that if you schedule attendant care on a regular basis, you get, again, I'm making it up, 20 hours a week, and that works for you most weeks. There are going to be some weeks when you need more, and that's when you pull from the respite hours. Really, it's like it's a difference on the timesheet, and you fill in a different little bubble for some of the hours, but it can be the same person. It can be different if you wanted. They can provide the same services at the same rate. Very, very similar. Oh, thank you. Okay. How can the ARC help with the waiver process? Oh, I couldn't find this online. I like to joke that we're there for the ungoogleable, like who on earth is going to figure all this out? Can I walk you through the process or answer questions? Yes, you can personally ask me anything that you want as many times as you want. The line for us, if you can imagine, is like, you can ask me anything. I can problem solve with you. I can give you links. I can suggest things. I can point you in certain directions. I cannot sit down with you and fill out paperwork, go to meetings for or with you, right? So I can give you information and try and empower you to do things. And you can ask me as many times as you hit a roadblock about what to do next, but you are the person who ultimately has to do this stuff. Or I can tell you about someone you could hire to help you do this stuff. Does an 18-year-old graduating from public school change your waiting list status? So what the waiver waiting list criteria says is that if you're about to age out of school and have no other support services lined up, then you're higher on the priority for the waiting list. That makes sense. And that can happen if you're graduating at 18 or somewhere between there and when you age out at 22, as you can imagine. The interesting thing I'll give here is that if you live in Arlington, Alexandria, Fairfax, Fairfax City, Falls Church, those areas, all of those localities recognize they have people graduate without a waiver all the time. And they alone will use local tax dollars, meaning not waiver money, their own county tax dollars, to pay for a person with a disability who graduates to have employment and day services, the exact same services you can get under the waiver, and sometimes even an extra service called self-directed services you can't get under the waiver. But because they're using tax dollars to do that, they won't do that until the person with a disability is 22 and has exhausted school resources. So waiver, yes, you could get on an urgent needs waiting list, priority 1, more likely to get a waiver if you're graduating at 18. But if you happen to graduate and you don't get that waiver in Arlington, Alexandria, Fairfax, Falls Church, Fairfax City, the only places that offer those local dollars wouldn't pay for you to have day and employment services before you're 22. So sometimes families do something like say, I'm holding off on 1 or 2 graduation credits until the person either turns 22 or gets a waiver, so that even though they graduated mostly, we've not quite left the school system. There's lots of troubleshooting that goes on there. How do you know when to apply? My kiddo is 2 and has lower support needs. Great question. And I should have talked about this. Apply now. There are a few reasons for that. Once you're on the waiver waiting list every year, though the state is not entirely consistent on offering this, there's usually funding called IFSP, same acronym as early intervention, but it stands for Individual and Family Support Program, that has historically been up to $1,000 a year in flex funding for that person with a disability to use on respite care, summer camp, attendance, medical copays. So $3,000 a year just because you're on the waiting list. Awesome. Also, by being on the waiting list, you are in contact with your community services board. They know who you are. So maybe you run into a situation, which I've seen before, where one parent is deployed and the other parent suddenly has to have surgery. After that parent recovers from surgery, you can probably go back to making it, but there may be a 2-week or 4-week or 6-week period where you urgently need some respite and some additional help. If you're already on the waiver waiting list and linked in with the community services board, the odds that they're able to step in on an intermittent basis, much higher. And you also want to know that if there comes a point where suddenly someone in our family has a very different situation, we get a new diagnosis, we have an accident, and we go from being low level to high level priority, we want to know we're already on the waiting list. And then our only job is to call the community services board and say, bump us up, not to say, oh my golly, we're living through a crisis and I better apply for that waiver now, right? So apply the sooner the better. And also we never know when that waiting list is going to go way down and be cleared. You want to be swept up in that wave if it happens. Okay, I'm applying for SSI for an adult child who's turning 18. He's already on the waiver and we applied for Medicaid before he turned 18, right? Because he'd have to have that with the waiver. And he was deemed not eligible. Would he be eligible for Medicaid now that he's 18? Yes. Even if someone with a disability without waiver couldn't get Medicaid before they turned 18, at 18, they're considered an adult and they should be able to get Medicaid and Social Security benefits as an adult. At 18, whether or not they have the waiver, whether or not they're still in school, they should be able to get Medicaid and Social Security benefits. So neither of those things should be an issue now. Do we have guidance for filling out paperwork for SSI? Yes. If you go to the arcofnova.org, under resource library, there's a whole section on Social Security. Don't get overwhelmed because there's like, I don't know, 6-8 documents there. They're all like 1 or 2 pages. So look at like the quick guide on applying for Social Security benefits, or just reach out at the arcofnova.org/answers and ask me a question and I'll link it to you. And we have YouTube videos on this too. If a person is selected for waiver but unable to use it because they can't find care, does the application go back in for future consideration? This is a tricky one to answer. So if the person is selected for waiver but can't find care because of the pandemic, and still at this moment, of which is August 9th of 2022, they won't lose their waiver. Medicaid has said we're not kicking anybody off Medicaid or waiver because they can't find a caregiver, recognizing that the world is in a jumble right now. In general, so I'll say whatever time we're post-COVID public health emergency and pre-COVID, if you didn't use your waiver every 30 days at least, you'd have to like get right on that, or you could risk losing your waiver. So it depends upon the situation. If you're saying, yeah, I haven't used the waiver for 60 days because I've been placing ad after ad and we haven't found a caregiver and it's not working, then your case manager or your team should be sitting down with you to say, okay, what services can we use? How can we problem solve? How can we make this effective? It's pretty darn unusual for me to see someone actually lose their waiver because they didn't have a caregiver, unless they got to the point that they said, like, I'm so exhausted with looking for a caregiver, the waiver's not enough benefit to us, we're quitting. All right, I see that we're at 11:03 and I started at 10:02. So we're right at an hour. So I'll try and be conscious of that. And I'm going to go ahead and stop our recording. I will stay on to answer the other questions that we have in the chat, and I'll stay on as long as y'all want. But like the depth and breadth of what we're going to cover today is there, and the arcofnova.org/answers. You can ask me questions anytime. If you're asking this question or you're seeing this webinar later, you can go there and ask for a copy of the slides or ask for anything about waivers or other related things that you would like. We are always so happy to help you at the ARC of Northern Virginia, and thank you for being here.